Health Organization Director General Tedros Ghebreyesus has called on countries to support the COVAX facility, a program meant to distribute vaccines to low and middle-income countries. The WHO chief says the bilateral arrangements to deliver COVID-19 vaccines run the risk of fanning the flames of vaccine inequity, stressing that it is time for partners, not to patronage. More in this report.
At a press conference in Geneva on Friday, Dr. Tedros noted that WHO had issued a call for vaccination to begin in all countries within the first 100 days of the year. He added that with Saturday being day 100, out of 220 countries and economies, only 194 have now started vaccination. According to him, 7 of the remaining countries have received vaccines and could start. 4 of 5 countries are expected to receive their vaccines in the coming days, leaving 14 countries who have not yet begun vaccination for a range of reasons. Dr. Tedros said there remains a shocking imbalance in the global distribution of vaccines.
There remains a shocking imbalance in the global distribution of vaccines. More than 700 million vaccine doses have been administered globally, but over 87% have gone to high-income or upper-middle-income countries, while low-income countries have received just 0.2%. On average, in high-income countries, almost 1 in 4 people has received a vaccine. In low-income countries, it's 1 in more than 500. Let me repeat that, 1 in 4 versus 1 in 500.
The chief of Global Health Body also confirmed that COVAX works, describing it as a strong mechanism that can distribute vaccines faster and efficiently than any other mechanism.
COVAX works. It's a strong mechanism that can distribute vaccines faster and more efficiently than any other mechanism. The problem is not getting vaccines out of COVAX. The problem is getting them in. We understand that some countries and companies plan to do their own bilateral vaccine donations, bypassing COVAX for their own political or commercial reasons. These bilateral arrangements run the risk of fanning the flames of vaccine inequity. This is a time for partnership, not patronage.
COVAX is one of the 3 pillars of the Access to COVID-19 Tools Accelerator, which was launched in April by the World Health Organization, the European Commission, and France in response to this pandemic, bringing together governments, global health organizations, manufacturers, scientists, private sectors, civil society, and philanthropy, with the aim of providing innovative and equitable access to COVID-19 diagnostics, treatment, and vaccines. The COVAX pillar is focused on the latter. It is seen as the only global solution to the pandemic, as it remains the only effort to ensure that people in all corners of the world get access to COVID-19 vaccines once they are available, regardless of their wealth. For iAfrica News, Pinta Jallo.